Hello, everybody. I'm Grant Boxleitner, and this is Local Doctors on Call. Today, our topic is natural prevention to dementia and Alzheimer's. And once again, Dr. Misha Payand is here. He's the president of East West College of Natural Medicine in Sarasota. He's also worked in one of the world's largest integrated hospitals in Shanghai, China. And it's nice to see you, doctor. So why is this topic so important?
This topic is important because we have a severe epidemic going on right now with the baby boomers coming up to age in our aging population. We're seeing a severe increase in dementia, cognitive decline, and Alzheimer's disease.
We hear a lot about that, even in the news. A lot of these stories are focused on that issue. Now, is there a way to naturally prevent or even reverse dementia or Alzheimer's?
There is. There's multiple causes of Alzheimer's disease. It's multi-causal, so we have to take a approach, a multi-modality approach to reversing decline.
And how do you go about doing some of that?
Well, we're going to have to look at a bunch of different components: diet, nutrition, lifestyle, medications. We have to work as a team of integrative physicians and get to the actual root cause of the decline in cognition.
Yeah, absolutely. And when you're treating patients, sometimes the research and trying to figure out ways, you have to concentrate on both. Is that fair to say?
Sure. That's why there's not actually one pill for Alzheimer's. There's no single pill to cure or reverse Alzheimer's.
Yeah, because there's no secret pill, wonder drug, nothing like that, at least not yet.
Correct. And again, it's because there's multiple causes to Alzheimer's. We do have some medications like Aricept that has some improvement, but usually it's only temporary.
Is it treating symptoms or?
Absolutely, just symptoms.
Okay.
And but there's some negative side effects to those. And knowing your genetic profile, that's one particular drug. If you have a genetic variation in, say, for instance, your CYP2D6, you're not going to be able to eliminate that drug and the toxins involved in that drug. So you can make a bad situation worse.
Yeah, it's a fascinating topic. Now, let's talk about some of these approaches, perhaps.
Sure. One, of course, is nutrition, taking a look at what people are eating. Of course, we're going to have to remove some things and add some things. Processed foods, for one, simple carbohydrates, sugars, grains.
And how do patients take to that? Obviously, when you're talking about some of their foods, they can potentially get a little sensitive.
Yes, very, very sensitive. And it's difficult to work with someone that has a lifetime of these bad habits. When they're 50, 60, 70 years old, trying to change these habits are very difficult. That's why it takes a team effort.
Right. And is this a normal progression? Like, does everybody deal with this the same way and you can almost chart it, or is it different for all people?
It's different for all people because there's so many different causes. So if there was one cause, then we could probably say there's going to be a particular progression. But because it's multi-causal, then people are going to respond and be affected differently. The idea is to get to the root cause of the decline. Now, this could come from a varying reasons. One, you can have someone that has a heavy metal toxicity or sensitivity, like mercury. So mercury poisoning can actually mimic dementia.
And I've read somewhere where once mercury gets in your body, it's not like other potential compounds. It tends to stay there, and there's really no way to get at least all of it out of your system. Is that right?
It's very difficult to get these heavy metals and toxins out. There's chelation therapy, for instance, but these take time. So again, taking a team approach, so going to a dentist who specializes in removing fillings that have mercury, and knowing how to do it properly.
Yeah, that's so important. And also, I see some other things, potentially a hormonal imbalance.
Sure. Women of a certain particular age we're finding more and more become hypothyroid, and they start taking medications like Synthroid. Well, that will work fine for many years, but it's going to come to a point where it's not going to work as well. The T4 is not going to convert to the T3, the active form, as well. So at a certain point, we're going to need to supplement that, and usually we use a desiccated form of thyroid.
So many things to think about, and even estrogen, testosterone levels, brain function.
Right, exactly. Those testosterone, estrogen, those are other hormones that will have a dramatic effect on our cognitive abilities. But by doing certain tests, we can find out, say for instance, a patient is deficient in DHEA, it's a precursor. So we can supplement the patient with DHEA, and we can see
Now, if you do something like that with a patient, how often do you monitor whether this might be having an effect? Is it like monthly visits or perhaps more?
well, what we're going to want to do is get a baseline of tests. And oftentimes these tests are more esoteric, if you will.
Right.
So we're going to need to find out what nutritional deficiencies a patient has. So doing an organic acid test and testing the urine, that'll tell us exactly if there's deficiencies in carbohydrate metabolism, fat metabolism,
Right.
B complex markers, things like that.
Establishing that base, so then you can kind of go from there.
Exactly, finding out exactly what the patient's deficient in so we can supplement them for their bio-individual case.
Now, when we're talking about these treatments, I know that some of the elderly take a lot of medications. I know my mother, she takes quite a few. And I'm just wondering if the combination of these drugs, if you're already taking these medicines, can have an effect on this treatment approach.
Absolutely. Oftentimes at East West College of Natural Medicine in our student clinic, we will have patients come in with their medical records and lists of all these medications that they're taking. And these are coming from the physicians that are specialists. They're going to the rheumatologist, their oncologist, their gastroenterologist.
Their heart doctor.
Exactly. So everybody's prescribing all these medications. And oftentimes what we'll find is some of these medications are doing the same thing, so they're just upping the dose.
Oh.
So again, part of that team effort is finding a pharmacist that will be able to work with the patient and take a look at all these drugs and say, okay, maybe we need to cut back on some of these. Some of these are doing the same thing. And
redundancies, perhaps, in some of these.
exactly. And once some of these drugs are supposed to be taken with food, without food, in the morning, in the evening. But what happens is the older a patient gets, the more they're less inclined to take them properly. So
To stay on the regimen.
Exactly. So let's take them all at one time. Well, all these chemicals at one time are going to have a different effect than if you took them individually. It's like going into your kitchen cabinet and taking all these chemicals and pouring them into a bottle. Something's going to happen, right?
Yes, absolutely.
So the same thing that is going to happen in our stomach if we take all these medications at one time.
So you do almost, as you have them set out, you almost want a calendar or something of the time to take each one of them to stay on point.
Exactly. So these medications, these combinations of medications can cause cognitive decline. So it's not necessarily dementia or Alzheimer's, that it could be misdiagnosed.
Yeah, and you really have to make sure that you keep a close eye on that. So are there approaches that families and physicians can take when we're talking about all this?
The best approach is, again, to come up with a good team, a support system.
Okay.
A holistic MD or a DO, holistic dentist, a doctor of oriental medicine, even a massage therapist, people that are willing to talk and communicate together to come up with a plan.
Absolutely. Really fascinating topic we're talking about here, Alzheimer's and dementia and the natural approach to trying to treat these devastating diseases. I mean, families talk about, losing loved ones, in front of their eyes. It's really something that we have to take seriously.
Exactly, especially if they're being misdiagnosed. And it's something that we can actually reverse just by simple things like modifying diet or supplementing the proper way.
Yes, all great information, Dr. Payne. We're going to have much more, and we will have more local doctors on call right after this.
I'm Dr. Misha Payan, President of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Welcome back to Local Doctors on Call. Dr. Misha Payan is here, and we're talking about natural preventions for dementia and Alzheimer's. And I want to talk a little bit about the brain and diet. How can diet potentially affect the brain when we're talking about these debilitating diseases?
Sure. There's a direct link between the amount of sugar and carbohydrates and grains that we eat that have an effect on the brain. No one explains this better than Dr. David Perlmutter in his book, Grain Brain. There's now what we even consider type 3 diabetes, which is basically related to Alzheimer's and insulin resistance.
Yeah, I've heard of type 2, but type 3, interesting stuff. And so sugar, simple carbohydrates, these are potentially bad for our brain.
Absolutely. They can have a severe negative effect on our cognition. By eliminating these, tapering them down, and not necessarily making extreme changes in the diet, but small changes over a long period of time, then we can see reversal in cognitive.
And we know that kids eat a lot of these sugars, the cereals, what have you, even some of the sodas. Does it start that early where you really need to be keeping track on it? Because when we think of dementia and Alzheimer's, it's typically something advanced age, although you can get it younger in some rare cases.
Absolutely. Now, it's a lifetime of these sugars and carbohydrates that the elderly are looking at right now. But as we're younger, our bodies have a better defense against these toxins and deficiency foods.
Can rid the body, break it down a little easier.
Exactly, but over time, over a lifetime of this damage, our bodies aren't able to.
So best to make those habits the younger you can. And
absolutely.
Great advice.
Starting with kids, but that's easier said than done in most cases.
For sure. Now, Alzheimer's and dementia, how can we, I guess, characterize this? Even some sort of a brain inflammation?
Yes, actually, there are other diseases that will mimic dementia or even Alzheimer's, like Lyme's disease.
Okay.
That could cause brain inflammation.
And that is caused only by that certain tick bite that you get, or
they are tick-borne it is a tick-borne illness. I think we're finding more and more that it can be transmitted, maybe even sexually, and by other insects. But right now, for sure, we know that it is a tick-borne illness.
Right.
And it's not necessarily localized to one area of the U.S. as it once was. I mean, this is Florida. It's close to Thanksgiving, so the snowbirds are going to be coming back with their pets.
Down,
right. So that's another thing to keep in mind and use as a differential diagnosis.
Absolutely. And is that the only disease that potentially gets confused with these two others?
No, absolutely not. Even a vitamin B12 deficiency can mimic dementia. There, we can do nutritional tests to find out if there is a B12 deficiency. Also, we can do a genetic test, and if there's a polymorphism with the MTHFR, the methyltetrahydrofolate reductase gene, then that says a person isn't able to process B12 as well as they should, so they may need more methylated forms of vitamin B12.
And when we're talking about mimicking these other diseases, memory lapses, things like that?
Absolutely, just cognitive decline, memory loss, things like that.
Great. All right, and as far as we talked about some of these, the B12 deficiency. Anything else that we should keep in mind when we're talking about these two diseases in terms of what it may be instead of these two?
Well, there's a ton of other actually things. For one, even the loss
you
of a
even mentioned,
spouse.
right? Yeah, grieving.
Exactly.
That could
So
trigger this.
if you have a couple that have been together for several years, with the loss of a spouse, they might exhibit signs of withdrawal that might lead to memory loss or dementia. But this is just part of the grieving process. So being able to find out the exact cause of this cognitive decline, that's the key factor, not just labeling it immediately
Yeah.
dementia at all.
All great information, and we're going to transition now, and you have something here.
Sure, let's take it over to Russ at East West College, and he'll talk about the new programs that we have going on right now.
Thank you, Dr. P. Here at East West College of Natural Medicine, we have a massage therapy program where our students will learn Swedish massage, acupressure, aromatherapy, deep tissue massage, and additionally they'll learn Asian modalities like shiatsu, gua sha, and moxibustion. These modalities will help provide a path to pain relief and relaxation. Now they can continue that path in our Masters of Oriental Medicine program. The massage therapy program will provide them with some of the credits needed to apply to our to our Masters in Oriental Medicine program. And so the massage therapy program is about 10 months long, and it would prepare you and get you started in the career of relaxation and pain management. Let me tell you about our facilities. We have an authentic Asian influence where we provide the highest level of education in our state-of-the-art classrooms and library. We also have a student clinic right on campus where every day our students see real patients and apply their skills. We also have an herbal pharmacy where we have over 300 raw herbs, and our students are able to put together formulas that will continue to treat our patients right here at our facility. What's great about once you finish your program here at East West College of Natural Medicine is for massage therapists, we'll assist you in the process to become licensed. And then we'll help you find a place to practice your skills, whether it's being a private practitioner or working for somebody else. Or you can continue your education in our Masters in Oriental Medicine program. Now, those students will have to be certified as well, and those students will be assisted by our Career Services Department as well, so they can begin their path to fulfill their dream. If you're interested in applying to our massage program, it'll all start with a simple phone call where we'll discuss your interest and the program itself. We'll set up a time to meet at the campus where we'll further discuss the program. We'll talk about what you're looking for in a career. I'll show you around the campus so that you can see our student clinic, our educational facilities, our library, and maybe you can meet with financial aid to discuss eligibility. Well, our master's program, if you're interested in applying to our master's program, that will also start with a simple phone call and a meeting at the campus. So if you're interested in applying to any of our programs, be sure to call us at 941-355-9080. The number's on the bottom of the screen. Or you can go to www.ewcollege.edu. Now back to you, Dr. P.
Thank you, Russell, for that information about the programs we're offering at East West College of Natural Medicine.
Yeah, really fascinating and interesting approach to this, really hands-on, and people can learn a lot, and anybody can go over there and see how this works, right?
Absolutely. We invite everybody to come take a tour of the college. We have a student clinic. If you're interested in the Oriental Medicine program or the massage program, please feel free to either call, speak to Russ, or just stop by.
And let's talk about where that is briefly for folks who don't know.
It's 3808 North Tamiami Trail, right here in Sarasota.
All right, well, we have a lot more to talk about when we do this final segment. I'm looking forward to that, and we are going to be right back with more Local Doctors on Call.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Hi, I'm Dr. Stephen Wrench, Dean of Clinical Sciences at East West College of Natural Medicine in Sarasota. Our approach to wellness using Oriental and Western medicine is often referred to as complementary, alternative, integrative, or even holistic medicine. We like to think of it as simply medicine. Call East West College of Natural Medicine today to schedule your consultation or to learn more about our program of Oriental medicine.
Welcome back to Local Doctors on Call. I'm Grant Boxleitner. Dr. Misha Payan joins us, and we've been having a fascinating discussion about natural preventions for dementia and Alzheimer's. And I want to go into a little bit more detail some of these tests that people can take. It's really important to kind of identify this. What are some of the approaches that you have as far as these tests go?
Sure. We have a couple tests that we would really recommend a patient take. One would be an organic acid test where we find out exactly what nutritional deficiencies they have, ranging from B vitamins to glycine, lysine, any type
Even
of
iron deficiency.
Absolutely.
We hear a lot about that.
Absolutely. Any nutritional deficiency we'll be able to find out and come up with a personal regimen. Also a genetic profile. With the genetic profile, we'll be able to tell if, again, a person has variants that would need more methylated vitamins like methylated B12.
So in a genetic profile, you can see that this person is prone to potentially having these deficiencies?
Absolutely, and also Alzheimer's. There's an APOE gene. It doesn't necessarily, again, it gives us an outline. It doesn't necessarily give us the ability to diagnose that someone will have Alzheimer's, but if there's a predisposition, especially if there are two alleles for the APOE gene with the 4, that's a particular gene. If it's homozygous, if you got the bad gene from both parents, then unfortunately Caucasians have a 75% more risk of developing it.
When do you think it's a good idea? I guess it varies on patients, but when is it a good idea? At what age do you maybe begin to take these tests?
I always suggest the earlier the better. Just by knowing your genetic profile, it tells you the cards that you're dealt. So that doesn't determine if you win the game or not. It's how you play your cards. So,
knowledge is power.
Exactly. Right? So you can do a whole lifestyle of modification, a whole lifetime of changes and modifications in diet.
And diet and everything that we've been talking about. And when we talk about diet, supplements play a key role in this. What are some of the other supplements potentially that people could potentially be recommended to take, or that they could consider taking to try to balance themselves out? Sure.
There's actually even a pharmaceutical drug called serifulin, which is basically methylated B12 and N-acetylcysteine.
Now, what is methylated B12 for folks who don't know?
Methylated B12 is just a type of B12 that has a different function in the body, without getting too technical.
Right.
But what's interesting is in the U.S., we think, okay, if we can go buy a supplement off the shelf, it's probably not going to work. It's not going to do anything.
Yeah.
But here we have an example of two things, methylated B12 and N-acetylcysteine, that you can get actually both of them from a health food store, but putting them together, it's a pharmaceutical drug. So it's funny how a lot of patients think, okay, I need a prescription for it to work, because supplements won't work. But that's really a misconception.
Yeah, it's a very interesting approach, and just combining these two things. But are there any other supplements to keep in mind, or we've kind of hit
Sure.
the highlights?
Well, some of the keys are magnesium.
Okay.
vitamin D3 and K2.
I hear folic acid. People sometimes have a deficiency in that, even like pregnancies and things. Is that something you need to keep an eye on all the time?
Well, folic acid is a synthetic version of folate. Like, so then we're talking about methylfolate.
Okay.
Folic acid actually is a synthetic form of that, invented I think in like the 50s, and that's when they were starting to fortify cereals.
Yeah,
So they were
okay.
using the synthetic form, and now we're finding that actually that's probably not the best supplement to grab for.
Oh, very, very
so
fascinating.
I actually tell my patients to avoid folic acid and use folate, the natural
Folate
form.
in the pure form. All right, so we've gone over a lot of material today. What are just some of those key points to keep in mind as we're summarizing this great discussion today?
Sure. I guess the call to action would be to, again, get a team of people together, of caregivers, family members,
Yes.
Caregivers, medical doctors, doctors of osteopathic, dentists, massage therapists, doctors of oriental medicine, that are all like-minded, that can work as a team and help people as a whole.
Yeah, they
and
often
take a
say
natural,
it takes a village. And
Exactly.
in this case, it's a great approach to ensure that you're getting the best care.
Exactly. Oftentimes these patients aren't the easiest to change a lifestyle of habits, so it does take a team.
And the take-home message that we can prevent and even potentially reverse some of these symptoms, if not the disease itself.
Absolutely.
Yeah, great stuff. Dr. Misha Payant, it's been great talking to you today about
Thank
this
you very much.
fascinating subject. I hope that folks really take this to heart because it's important stuff. And I want to remind everyone to go to the website, and you can let people know what that is. The phone number is right there as well.
Absolutely. The website is ewcollege.org, and again, come visit the college, take a tour, become a patient or even a student of the Oriental Medicine program or the Massage Therapy program.
Doctor, thanks so much for
Thank
joining
you very
us.
much.
And that is going to do it for Local Doctors on Call. Until next time, take care.
Ever dream of helping people? At East West College of Natural Medicine, our massage therapy program could help you achieve your dreams. Our program combines the theory and clinical application of various types of massage treatments and modalities. You could discover a path to providing pain relief, help increase mobility, and share relaxation. Let us help you realize your dream. Call 941-355-9080 today.
Hello, I'm Dr. Misha Payant, President of East West College of Natural Medicine. For over 20 years, we've been helping our patients improve their health and, more importantly, maintain their health by using Oriental and Western medicine. Many of our patients refer to us as the best kept secret in Sarasota. Call today to schedule your consultation or for more information regarding our program in Oriental Medicine. East West College of Natural Medicine. It's not a secret anymore.